Myself, I am Dr. Puneet Girdhar and I am heading the spine surgery department at BLK Max Super Speciality Hospital, New Delhi. The various spinal indications where the robot can be used during the surgery are as follows. One of them is spinal stabilization, a routinely performed procedure where either there is a slip of one vertebra over another or some sort of degeneration in the spine which leads to instability. This is usually called spondylolisthesis and leads to difficulty in walking and immense back pain. This procedure requires stabilization by inserting pedicle screws and an interbody cage. With the help of robotics, all this can be done with the help of an AI-based software whereby the spinal implantation becomes near 100% precise and accurate. Also, it allows us to give smaller cuts so that the procedure becomes even more minimal invasive. The hospital stay gets reduced to 1 or 2 days and the patients are usually back to work within a week's time. The other indications for performing robotic spinal surgery are spinal deformities, whereby patients have a hunched spine, like in kyphosis or scoliosis. The correction requires insertion of screws in twisted vertebra. That can be challenging without the help of technology if we have to do freehand. With robotics, the entire CT scan of the patient can be fed into the robotic software and a preoperative planning on the designed entry and trajectory for your implantation can be done beforehand, and the robot can help during the surgery to precisely replicate the planning and execute it accordingly so that the screws can be placed in the exact direction as planned to achieve 100% accuracy as well as avoid any injury to the adjacent nerves or blood vessels. Moreover, the entire planning of correction as well as the alignment can be planned with the help of the robotic software. Moreover, in patients with spinal fractures, a percutaneous or minimal invasive technique can be used to perform spinal fixation with the help of the robotic Excelsius GPS. In elderly or geriatric patients who have suffered a spinal osteoporotic fracture or fracture due to a weak bone due to various diseases like cancer, a procedure called kyphoplasty is performed whereby a cementing is done to enhance the strength of the bone as well as to restore the height. This eventually eliminates the back pain because of the fracture and allows the patient to be mobilized early. With the help of robotics, this procedure requires a lot of radiation for it to be performed with minimal invasive techniques. With the help of robot, most of this radiation can be avoided and a precise implantation of the balloon as well as the cementing can be done without any radiation. In the nutshell, wherever a spinal implantation or a spinal targeting is required, robotics assists us to perform the procedure with minimal invasive technique with smaller cuts, do it precisely and accurately, and at the same time avoid radiation. This has eased the life of the surgeon as well as passed on major benefits of safety during spinal procedures to the patient.